show Girl Let's Talk. My name is Nonhlanhla Mabhikwa, and today we're going to be talking about mental health and depression. So I'm joined by two lovely young people, Eugene Tshuma, who is the programs officer at Youth Zimbabwe, together with Duduzile Mhlanga, the communications officer. Welcome to the show, guys.
Thank you.
So before we talk about mental health and depression, Eugene, tell us about Youth Zimbabwe.
So, Youth Zimbabwe is a youth-led and a youth-serving organization that is based in Zilikazi in Bulawayo. So there are quite a number of programs that we actually implement, some of them in Bulawayo province and some of them that actually cover other provinces in Zimbabwe. And our area of strength is actually in economic strengthening, and we also implement programs around sexual reproductive health, mainly doing demand creation. So some of the programs that we are currently implementing as an organization include the Brother to Brother program, whereby we bring young people aged from 15 to 24 and we discuss different issues. Then we have our new program that is called Alternative Perspectives, whereby we also bring about old and young men to actually discuss issues that they encounter on their daily lives. We also implemented a program that was called Siaka, that was targeting adolescent girls and young women. So these are some of the programs that we're actually implementing as an organization.
Wow, quite interesting. Any additions on your side, Duduzile, maybe to also speak to mental health issues as an organization?
For us, mental health, basically we do not have a specific program that we say we are focusing on mental health, but we try by all means to mainstream mental health in all our programs. We have aspects of mental health in the Alternative Perspectives project, whereby we are looking at men and their mental health, what's affecting them, and how can they make it better. For Brother to Brother, we also have topics, since Brother to Brother is more like peer-to-peer education. So there are topics that they cover that mainly focus on mental health, drug and substance abuse. And then we also have campaigns, like the one that we did recently, the Start Now campaign, that was just focusing on mental health. The name Start Now, with Start Now focusing on what? Mental health. Start Now, we're focusing on recreational groups like soccer, netball. How do they deal with mental health as teams? Coaches, how do you deal with your player when they are now depressed or when they are going through stuff? How do you help them recover from that? And also focusing on sport as a way of dealing with the mental health.
Wow, quite interesting. And, it's good to hear that it's an initiative that is led by young people for young people to have a better life, really. Now, we've thrown the word mental health around and depression. And, over the past years, we've heard of, we've lost a lot of young people. And when we ask why, we are told, no, they had mental health issues or they had depression. Please explain to us what is mental health and what is depression.
Okay. I'll explain on my own understanding as a young person what mental health means to me and what I understand depression to be. Mental health, it's a state of your mind whereby you are able to deal with stresses of life. You are able to overcome and be part of a community and build community and have focus on where you're going and where you want to achieve. And when we talk depression, it's a mental health disorder whereby we are saying there's a level whereby we're saying depression, your level of depression, maybe you're going through stuff. How are you at that point? You are at the lowest in your life, and then you overcome that. Then there are others who are more depressed that they will then need clinical services, but at times some just need psychosocial support, and then they get over that. So it has different stages. Everyone goes through a point of mental health. So everyone has gone through a point in their life whereby maybe they were in a bad mental health state, but some managed to deal with it, some failed to deal with it, then ended up maybe being suicidal, some being admitted in maybe Ingujeni, institutionalized, we can say.
Wow. Eugene, any additions on depression and mental health?
I think she said it all, because like she said, mental health is the state of mental well-being, whereby I'm expected as a young person to function properly in a society and actually contribute in whatever that's supposed to be done.
Right. Oh, we've come to a point where we have young people that are not able to cope. What is troubling young people? Why do we have young people struggling to cope, or live up to the societal setup really, and be able to do the things that they want to do in life?
I think a lot is happening, and looking at the nowadays we're actually living a fast life, and we as young people are failing to actually cope with what's happening around. If we look especially in Zimbabwe at the economic situation, a lot of us young people are not employed, to spend a lot of time actually trying to ngwava, as we say, and we talk about things like drug and substance abuse. If you actually go around the streets of Bulawayo, even right now, we will find a lot of young people drunk. And we even talk about things like inheritance, whereby these things have been happening. But I'm sure Guti, if we actually talk about mental health, of late, abazali babesithi kuthiwa ngamaloyo, and we're not accepting Guti mental health has been there. So there are quite a number of issues that are actually triggering things like depression, mental health, and even the high numbers of suicide, especially amongst young men nowadays.
Indeed, especially amongst young men, and it's quite alarming. Duduzile, any additions as well on the causes of mental depression in our society?
Actually, these days, Tanya go through, that's the word on the street. Winning, guys, like when we talk of mental health, for us young people, the expectations, they are too much. Our parents, they were growing up, going to work and actually having a functional salary that can actually buy you a house, buy you a car, be able to hambe keep amalobolo and all those things. But for us, it's different. The way we have been socialized with the advent of globalization, we are living in a global world. The world is one now. We have social media. There is one thing that I think for me, that's what really affects us young people. The need for every human being to belong, to be a part of. When we are growing up, I remember, like, for us, there was a civic day at school. You know, your parents will buy us uniforms, stationery, and everything. The other things were not important. But come civic day, that's when you will see, guys, I do not belong. Because when others are wearing jeans, you do not have jeans. It becomes a stress for a child to actually say, today I know that I won't belong. But when we are wearing the same uniform, we all belong. So that's the same with us young people nowadays. Like issues of going out, I'm a vacation, weaves, young people are driving, but you are not there. That causes mental health, like mental health unwellness, because you want to belong, you want to be a part of. But with the situation for us, you go to varsity, you struggle all the 4 years, 5 years. After that, there are no jobs. But parents are expecting you, we have done everything for you. Now you have to look after yourself. But I do not have a job, I have nothing. I'm still going back home and asking for stuff. So those are some of the issues, like Eugene has already said. Those are some of the issues that we are struggling with. There is the social media. People are posting pictures. People are posting stuff. People are going out. People are buying cars. People are getting married. People are doing this. And then I feel left out. It causes a certain... I sort of exclude myself. And I don't feel like I belong. And that causes suicidal thoughts, mental health and wellness, ending up going drugs way, and everything else.
Yeah, it's It's just a lot to take in, and I'm actually now thinking about a lot of people. And you know, talking about social differences, maybe let's talk about that. Ukuthi we come from different families, and someone sitting there might think ukuthi, you know, you should know where you come from and accept your level. Why are you comparing yourself with other people? Eugene, what's your take on that?
I think as much as you will tell me ukuthi I should know where I belong, I know where I came from. I know maybe the sacrifices that maybe my mom or whoever is looking after me abaziyenzayo. But the truth is, as angihlali endlini kuphela, and I go out, I meet odude esebenza sonke, and even my peers who are actually doing better than me. Because if you look at suicide cases, especially amongst the young men that I was referring to, uzathola ukuthi abaningi bakhona bathi I killed myself just because bengibona impilo engasahambi, because I was actually comparing myself to the next guy olingana lami who's bought himself a car, osebenzisa an iPhone 13 and stuff like that, and it's someone who we actually went together, maybe a college or started sonke lani. So as much as we can say ukuthi know where you come from, know your values and stuff, let's also be in mind ukuthi we don't live in a vacuum whereby ngihlala ngiyi-one lezinto ezinjalo. I go out, I see people, I see things. I also have ama-dreams and aspirations engiwafuna emilifini yami. And uthola ukuthi most of the times we are working, maybe in the next coming 5 to 10 years sihlezi without even impentsheni etholwa ngabadala. So
yeah. Now, coming to you, Duduzile, you know, when we started off, I asked for the definition of mental health and depression. But are these new things? We've heard a lot about it now, but is it something that is new?
Personally, I don't think it's something new. It's something that has been there. But however, society had always found a way of dealing with it. Culturally, maybe they were not talking about it. It wasn't really out there. But like I said, from when I was defining, when we were talking about the causes, like the globalization, moving away from our cultural ways and being out there, it becomes more out there. That means everything is now more out there. And everything now, the world has changed. It has changed a lot. The economic challenges that we are facing now, they were not facing them then. And now, usually people that always talk about I'm a 2K, I'm a 2K, I'm a 2K. But there are factors that have led to why now mental health is out there. Remember, growing up, you grew up with your mother and your father around. They will talk to you, they will see maybe that something is wrong. But now we are not growing with our parents being around. There is the migration, moving to the UK, moving to SA, moving to Botswana for greener pastures, which is exposing children to a lot of things. Sexual abuse, emotional, physical abuse by maybe people who are taking care of those kids because the parents are not there. That means there are now more factors that are affecting the mental health. And by also the exposure, children learning, you know, when you look at yourself, when you're doing ECD, if someone gave you a laptop or a phone, were you able to operate the phone? But look at the ECDs that we have now. Give them a phone, they can actually operate it. I think that's the same, the exposure that we are getting. It means we are being exposed to more things. Some of the things that we were quiet about, that you will not talk about, that you would think maybe, we always thought it's right, we're right, but we did not see the extent what's the extent of ukukhuzwa lokuchaya? What's the difference between abuse and discipline? But now, because of the exposure, we now know this is abuse, this is discipline. Same applies with emotional abuse. You know, when you grow up, your parents tells you, you will never be anything because of this. And that affects esteem, self-esteem yomntwana. But we never saw it as abuse. We thought parents are being parents. But with the exposure, with learning, with new things coming in, we now know this actually affects mental health. Especially, like you said, I'm the communications officer. When we talk communication, they will tell you what a child starts learning language when they are still in the womb, their mother's womb. From the mother communicating with their child. From the father, that's why now they tell you the father has to touch the stomach and communicate to the child. Because the child starts learning the language from there. From the early childhood, the child is learning how you're supposed to communicate, how you're supposed to act as a person in the community, how a father acts, how a mother acts. They learn from that early childhood. But when we're growing up, we never knew those things. We just thought, Mntwana is just being Mntwana. They will outgrow this, they will become this. But we never knew whatever we were doing to them at the youngest age, that was contributing to whatever they will become when they grow up.
Wow. Eugene, are you a father yet?
Not yet.
Not yet. Okay. She spoke about disciplining and abuse, and some people have said abantwana bakhathesi, they just hide behind depression and mental health, and they use drugs and all that because gabasachaywa. As young people, what do you think? Sichaye yini abantwana? If you are to become a father now, would you beat up your child when they do something wrong?
I think abantwana yabembaphethe ngama-fish fingers. But I think this is very subjective. It depends. Because like she said, there is a way that we should discipline abantu abethu, and there is a way maybe egcina isidlulisela to the abuse side. Because if the way nowadays things are happening, because if ungakhangela the way khona ukuthi abantwana basakhuza, it's given rise to the ilokuz and high numbers of bullying cases in school, just because from the home setup, the parent doesn't know how to actually discipline their kid, because engamchaya or uyamkhuza, they can be easily reported. At school, So I think maybe as a society, we sit down and actually relook at our values as a society. This is what we value, and maybe find best ways on how we can actually correct our children.
Parenting and mental health. He's saying we should find maybe a way as a society to know this is what works for us. And what do you think about that? Should we beat up our kids?
I'm a Christian. And the Bible says, spare the rod, spoil the child. Those are my personal beliefs. But like I said, there is a limit to everything. Too much of everything is not good for us. So a child, we should have a difference. Like what they will say when you go police, and they will tell you it's not a crime. But it then becomes abuse. So there is a difference and there is a limit to everything. So as a parent, it's up to us. We choose how we parent. Some actually believe that talking to a child is actually more effective than usebenzisa, and which it works for them. But same applies when you talk to a child. What are you telling them? When you're telling them, this is wrong, this is right, you should do it this way. But when I go to a child and tell them, like, why did you do this? You'll be a failure in life. You're a failure, that's why you're doing this. The child, that's imprints in their mind.
Thinking,
and even if they are at school, they are not giving an effort because you have already told them that they are a failure. So they are not even at a competition level with other kids. Because as a parent, they trust you. That's the person that they trust the most. And you're supposed to be encouraging them. But if you as a parent, you are telling your child that when you are a failure, when I very sell, those things imprint in their minds. And as they grow up, they tell themselves, that's what my parents told me, I'll be this. So why should I try? Why should I? And it's self-esteem when they are now at school, even if they are playing with other kids, they are different. They are not at the same level with other kids. It will low self-esteem. So those are some of
Yeah, speaking about, low self-esteem, those are the effects of, bad parenting. Let's talk about the effects of depression. Or before we go there, maybe let's talk about the signs. How can you tell that, this young person now is mentally unwell or has depression?
Now, I think maybe some of the signs that we should be aware of maybe when dealing with young people, not even young people, but everyone. Maybe the first thing is we tend to lose interest, maybe, of izinto awuthuzithanda before. Then maybe another sign is just general cleanliness, because some people, when they are going through a stage, say depression and stuff, they actually forget to and things like that. Then maybe another sign that we can look out for is the use of armor drugs and alcohol, especially hard drugs, because I know some young people do take alcohol, but when maybe they are going through depression or going through some stuff, they tend to use armor drugs or alcohol is excessively. Yes. And then maybe even their relationships, either their sexual relationships, and even their performance at work, if it's a young person who's actually working, they start maybe underperforming, and even their interaction with the people in the community, it actually becomes bad. Some people even tend to actually withdraw. We can be in the same space, but you can actually see that umuntu lo asikho sonke, and other people even tend to actually not go out, saying isivalele endlini, and spend 1, 2, 3 weeks. So there are a lot of signs that we can actually look out for, maybe especially labantu esihlala labo, because we usually know ukuthi uno unjani, i-day lakhe linjani, or ama-weeks akhe kanjani, ngumuntu lo imude enjani.
Any additions on signs?
It's something that I've always low self-esteem at times. We have to look at where is it coming from, that low self-esteem. Even at school, like he has already said, underperformance, withdrawing, and also excessive intake of alcohol. And then also the other thing, when especially for young people, how do they, like, maybe in a space where there are other young people, they say staring into spaces, not being there totally, like with other people. I think those are the...
Now, as young people, you've spoken about depression and the effects and all that. You've also seen the government, maybe even the police, doing something about drugs and alcohol abuse. Even the president himself, when he opened the 10th parliament, he said that they are concerned about the youth, drugs, their mental health and all that. What is it that you as young people think should be done to help, have a young people that is mentally well and functioning well in the society?
I think maybe the first problem, as much as we can say that a lot is being done, maybe when we're looking at mental health and maybe dealing with issues of drug and substance abuse, the problem that we currently have is, as organizations or as different stakeholders maybe operating in communities, we are actually working in silos to such an extent that our interventions actually don't give us maybe the desired results that we want. So maybe I think the first thing that we can do maybe as stakeholders or as communities to actually make sure that we pull the resources that we have together and actually plan these interventions with the targeted young people. Because most of the times we sit in our offices, we plan interventions, then we take these interventions to the communities. Then at the end of the day, it's not what young people want. Then they actually, it's either they go back to drugs or they even don't come to our interventions. Then I think maybe the second thing that maybe can be done is to actually make sure that in each and every program that we're doing, is either it's workplace programs or it's programs that are being implemented by NGO or even churches, let's try to actually make sure that we mainstream issues of mental health. If we're talking, let's say, about sexual reproductive health, let's make sure that we also talk about issues of what? Of mental health. Then I think the other thing that we can do as a community is to actually make sure, because ukutama drugs are thengiswa ngaphi, we know. Is the some of the people that are selling drugs are our parents, abasigcinayo ngemali yona le yama drugs. So I think maybe we need to sit down as a community and actually see how best we can economically strengthen families, so that at the end of the day, these people that are actually selling drugs, abahlala kuma communities, to they find maybe better means of making money. Because I'm sure we have seen maybe houses being raided, kuthathwa drugs, but 2-3 days down the line, umuntu sephendukile back into the business and stuff like that.
Wow, Dudu, you spoke about rates. And again, I've spoken about, the president expressing political will to address this issue of drugs. Do you find that effective, the police raids? And maybe now we have a youth bill that is upcoming. Do you think that those are effective ways, and what can be done on top of that?
For me, the drug and substance abuse part is more of the aftermath of mental unwellness. So let's first address the issue at hand, that is mental unwellness. What is causing that? How can we make our communities more understanding to the issues of mental health? So first, for me, like you said, the previous question, is it enough? It's not enough. For me, mental health is a new pandemic that we have at hand, that if not addressed very well, is something that is going to be maybe the death of us all. But let us look at it from this way. How have we been dealing with pandemics? That's the same way we are supposed to deal with the mental health. Let's have communities being more capacitated in ways of dealing with mental health. Let's have mental health being mainstreamed even in our health system, where I'm able to get mental health services at my local clinic, than for me to say addict, asemhambisene ngutsheni. And ngutsheni, is it capacitated enough to handle mental health, or is it capacitated to help people with mental disorders? But my mental health maybe needs psychosocial support. Are they capacitated enough to give me psychosocial support? At schools, we have bullying. We have kids who withdraw, kids who have gone through traumatic experiences. Are schools capacitated enough to handle those things? Even the bullies, the ones that are bullying other people, how are they handling them? Don't they become outcasts in the schools? Are they offering that child psychosocial support or psychological support? We have many youths that have graduated social work, psychology. Let them do what they have actually learned in school on the ground. And those are some of the things that we should be putting into effect. For me, that's...
Yeah, and you spoke about outcasts and support from home, from the immediate people around you. Let's talk about the stigma around mental unwell people and people with depression. Eugene, what is the situation on the ground when we speak about stigma, and when you really invite people to say, let's talk mental health?
What to say, Hlanya? I think, like I said earlier when we started the show, if we are talking about issues of mental health, most of times loyo. So if I start maybe behaving in a way that's different from the usual Eugene that I think our communities are not really ready to deal with someone who has a mental breakdown. That's why we are seeing you see someone maybe who's actually breaking down slowly. At this level, maybe we can actually try something and maybe even but just because of the stigma and us not wanting to associate with that particular person, umuntu uyashifta maybe from Bopoma and limbone SSA town and seqalisa ukufuza amabhimi. But if we actually created an environment that is actually conducive enough, maybe first of all for me to actually sit with my friends or with my family and actually talk about what's bothering me. Or if I didn't actually have that environment, if you actually see I'm breaking down, if the environment is conducive enough, I think we shouldn't be talking about issues of stigma. Because I'm saying depressed and actually she's able to see it and support me and be associated with me going any labeling. angiboni ukuthi singaba le problem.
Dudu, as we close off the show, what is your message to young people out there, both women and, young women and young men out there, when it comes to issues of mental health and depression?
Maybe before I get to that, there's something that I wanted to say, and I had actually forgotten to say it. When you're talking about the signs that we should look for when someone is actually going through depression or mental health, there's also something which is a sign that we have, maybe really for us, let me say Africans, that we have never really looked at: eating disorder. That's also a sign of a mental unwellness or a depression, whereby we have someone maybe odla kakhulu, or someone who's not eating, or those eating disorders. Those are also some signs that we should also look out for. And then my message to young people and the communities out there: let us change the narrative when it comes to mental health. There are things that are that are part of our socialization that affects our mental health. I'll speak especially for men. The studies actually show that women are most likely to be affected by mental health. But I don't think it's that. I think it's because women, we have been socialized to speak out and be emotional. But Eugene Tshuma, so they don't actually speak out. Remember when HIV started, women have actually better health-seeking behaviors compared to men. So I think that's the case with mental health. They have been taught not to be emotional. They have been socialized not to speak out. But they are actually going through a lot, just like women are going through a lot. So let's change the narrative. When it comes to socialization, let us learn to speak out. Mental health is just a disorder like any other. Let's fight the stigma. Actually, at some point in life, we have all gone through a state of being mentally unwell. There are times whereby those are, but it then goes to how do we then manage that. So let's change the narrative towards mental health. It's up to you and me. Everyone has a role to play.
Any closing remarks, Eugene?
I think maybe my message to young people is let's talk about it. Let's make sure that we cultivate healthy relationships with people that we live with, to such an extent that we are able to talk about whatever that's bothering us. And maybe to the stakeholders who are actually implementing different interventions, let's make sure that we have proper messages surrounding mental health. Because I think currently, as much as we might be implementing programs on mental health, I don't think there is proper messaging around mental health.
Wow, interesting. I've just had a lovely discussion here with young people speaking about mental health and depression. And, I've learned a lot. I've learned that, we should socialize our young people, our children, into being able to open up and speak out, and not, say because you're a guy, you shouldn't cry. Because you're a boy, you shouldn't be emotional. Let us allow our young people to speak out and express themselves, without putting so much pressure to them. And yeah, it's been a lovely discussion. Please stay tuned for more of our shows. Don't forget to follow Site ZW on Facebook, Instagram, Twitter, X, formerly known as Twitter, as well as YouTube for more of our programs. And remember, site.org.zw for the news. Otherwise, from myself, Nonhlanhla Mabhikwa, Duduzile and Eugene here, it's bye.